How this is all being handled, we're joined by Lukhona Mnguni, a political analyst at University of KwaZulu-Natal. Mr. Mnguni, thank you very much. Having listened to both sides, lie with one or the other at the moment.
Evening, Francis. This is not about sympathies lying with anyone. This is about looking at the facts before us objectively. We've got information from the World Health Organization, and I think Michael Ryan, you've been playing his clip this evening in terms of how do you open schools and what do you look for. Let us step back a bit, Francis. When we moved towards level 3 lockdown, we moved against the guidance or the advice of the WHO because they had created about 5 or 6 preconditions that need to be in place. Chief amongst those was the question around our ability to test, our ability to have good public surveillance, and of course, another one was that you should open your economy when your rate of transmission is actually on the decline. In South Africa, and probably this is one of the most unique cases around the world where with the kind of daily infections that we are seeing, we are actually seeking to open up more and more. So for me, it's about looking at the facts objectively. And I think what has happened in government, 2 things have happened. It's either government no longer follows science or government from the local scientists is getting wrong scientific advice, or it is getting advice that is tailor-made to actually be part of the political correctness around the debate on opening up the economy, getting the children to school, when we know that the virus doesn't move itself. Even the president mentioned this in his speech. He said it is the conduct of people and their behavior that transports the virus. But in the conduct of the people, it's the mobility of people that actually moves the virus. So when your infection rate is high, I would imagine that in order for you to lower the community transmissions, is that you then go back to a much more restricted form of movement in your society, and that involves closing down the schools, closing down some sectors of the economy, because level 3 saw about 10 million people leaving their homes, 8 million workers, 2 million learners and teachers being sent back to be mobile in society, and that is now backfiring. In some instances where this has happened around the world, in Australia, we have seen people returning to a lockdown. California just yesterday was announcing that they are returning to a lockdown as well.
Mr. Mhlanga, this is such a huge issue because, poverty, unemployment in South Africa is so huge. So that also has to be factored in. And we're only talking about schools here because it seems like government has decided the economy will remain open. So does that create this inconsistency now, which Mr. Mhlanga spoke about? Maybe you have children staying at home. Sometimes they are left alone. They're vulnerable, although we're talking about these community solutions. But then you have the parents climbing into full taxis to go to work. So if we close down schools, is it a redundant move in a sense if the rest of the economy and transport is the way it is in South Africa?
Well, it's not only the parents who are jumping into the 100% fully loaded taxis. It is also the teachers who commute to schools. They are also at severe risk, and therefore they transport this. Let's step back again, Francis. This question around kids being left alone. I said elsewhere that what should have happened during the opening of the economy is that you allow the smaller children to go back to school. And that's how it has been done globally in some of the countries. If you look to France as well, if you look to how China welcomed children back to school, they started with the early childhood development and primary school going because they are the least susceptible to the virus. But what did we do? Because we are chasing the highly politicized metric results. We opened for grade 12, we opened for grade 7, nothing was objective there. And these are the children that can be left on their own at home, who can look after themselves. And we left the ones who actually need care and facilities of care at home. So the logic was already, for me, in an inverted way by the actions of government. Yes, we do have a problem of livelihoods in South Africa that are highly precarious, people who are in unsafe and unsecure jobs, people who are under-earning even in the jobs that they are in. But you are not going to solve that problem by opening up the economy, because it is that very economy that has actually exacerbated the inequalities that we have in our society. It's almost a falsehood in a way, because there are people who will never go back to jobs because there were no jobs for them before. There are people who are not going to go back to jobs because they were retrenched. There are people who are going to go back to jobs for a month and then companies are going to close down because they can't handle their overheads, because they are functioning in an environment that has a high input cost because of all the measures and protocols that are put in place to manage the pandemic. So how can we be innovative in our policy making? I would say, for example, if I were government, I would say, okay, teachers, if we are going to close schools, can we have a pact? Can I take 1,000 rands from each and every teacher and give it to the most 450,000 or so indigent households, because that's almost the number of teachers we have in our society. So there has to be a social compact that looks at both managing the pandemic and, yes, managing the issue of livelihoods, particularly for the most vulnerable households. And I have proposed in one column I did on the 28th of May that government must look at public salary cuts and reductions that will then fund social relief, because our problem in South Africa is that we can't afford social relief within the fiscal framework that we have. So we then have to find a social compact that allows us to try and find a gap. But to send out people, vulnerable people, poor people, saying that they must open windows in cold winter because they are poor and they can't travel on their private cars, I think that for me is an anti-poor strategy. It's disdainful and it must be rejected, and we must find ways on how to cushion the most vulnerable households as we handle the pandemic. But to send out poor people as COVID bouncers, it is the first time I'm seeing it around the world, and I think I've watched a number of countries and how they've handled this pandemic. With our cases, it is almost gravitating against being unscientific.
All right. Thank you very much for your analysis. Political analyst at UKZN, Lukhona Mnguni.